Why is LGBTQ affirmation training so important for the entire healthcare team? Before we get started, anytime you see this heart appear and hear this sound, look for a citation in the references. This is our friend Sticky as a baby. Sticky grew. And grew some more. This is Sticky all grown up. Sticky grew up and exists on Earth. Our Earth. A heteronormative Earth. Sticky identifies as part of the LGBTQ community. Sticky's Earth holds harmful ideas towards LGBTQ people. Harmful ideas such as you're a sinner, it's just a phase. Girls don't do this, boys don't do that, and you're not welcome here, just to name a few. Sticky's Earth also does harmful actions towards the LGBTQ community. Harmful actions like dead naming, bullying, rejection, being forced to pick male or female, and bathroom policing. Not only that, but Sticky's Earth even has harmful regulations towards the LGBTQ community. Harmful regulations such as not being allowed to play sports, not being allowed to adopt, being denied medical treatment, being denied spousal privileges, and anti-LGBTQ legislation. As of 2019, LGBTQ laws vary widely across the globe. Same-sex marriage is not recognized in more than 85% of countries. Sticky feels the full weight of the stigma and stress of simply existing on this earth. This cumulative burden is known as minority stress. Being part of the LGBTQ population does not cause an increase in negative health outcomes. Rather, the lifelong stress load weighted down by stigma, prejudice, and discrimination does. Minority stress is like living your entire life trying to survive a storm on rough seas. This minority stress leads to health disparities. A national health interview survey reported the following findings in health-related behaviors amongst adults. Increased rates of drug and alcohol abuse, increased rates of tobacco use, increased rates of obesity, increased rates of cardiovascular disease, and decreased rates of preventative services and screenings. LGBTQ youth are particularly vulnerable. They are 4 times more likely than their counterparts to attempt suicide. In the last 12 months, 42% have seriously contemplated suicide. And every 45 seconds, an LGBTQ youth attempts suicide. Remember, these risks are not because of sexual or gender identity, but because of how they are stigmatized by society. 28% of LGBTQ youth reported experiencing homelessness or housing instability at some point in their lives. 30% reported food insecurity in the last month. And 72% reported generalized anxiety in the last 2 weeks. Those statistics encompass data collected from all LGBTQ youth. These risks further increase for youth of color and trans and non-binary youth. Wait. We can make it better. But how? This is Hippocrates Nightingale. Hippocrates Nightingale represents the entire healthcare team, such as providers, nurses, medical assistants, administrators, office staff, and pretty much anyone who could have contact with a patient. Healthcare teams are uniquely positioned to improve health outcomes and reduce health inequities. Affirming healthcare teams reduce LGBTQ-related stigmas and allow for more truthful information exchanges. So, how do we get there? It all starts with affirmation training. Both the American Nurses Association and the American Academy for Family Physicians recognize the importance of providing affirming care to LGBTQ patients. Nurses are bound by a professional code of ethics which demands respect for the dignity of every person. Physicians are guided by an understanding that improving access to care reduces health disparities, and achieving this requires staff trained in providing inclusive and affirming care. A systematic review completed in 2021 sought to find the best way to reduce LGBTQ healthcare disparities. 15 of the over 1,000 articles retrieved during the review met the search criteria. Affirmation training was implemented in multiple locations worldwide, in private practice and across multiple hospitals, and with different members of the healthcare team. The results showed a universal improvement in knowledge and attitudes of the participants post-training. The affirmation training took place in various forms and lasted from less than 2 hours to multiple days. Whether online or in person, or how much time the training lasted, all resulted in an improvement. So what is affirmation training anyway? Remember Sticky? Affirmation training starts with understanding the minority stress that Sticky has endured their entire life, and how that minority stress has created increased health disparities, like we discussed earlier. Affirmation training should discuss evidence-based best practices, including use of correct names and pronouns when addressing patients, creating inclusive data collection forms, having inclusive literature and posters displayed, understanding specific health needs of LGBTQ individuals, and knowing where in the community to refer patients with needs beyond the scope of the current setting. Maybe Hippocrates Nightingale could even wear a special name tag with their pronouns and an emblem indicating they are a safe space. Sticky decides if they want to come out to every individual member of the healthcare team they encounter. This causes many LGBTQ members like Sticky to avoid seeking healthcare. However, affirming healthcare team members, like Hippocrates Nightingale, reduce the stigma Sticky faces when disclosing sexual orientation, gender identity, or gender expression, and allows for more truthful information exchanges. With the proper training, we can take at least some of the weight of the world off of Sticky's back and help reduce health disparities.